Hi, this is an overview training of the Mini-CEX clinical assessment tool. My name is Chris Eric. I'm the Assistant Dean of Chiropractic Medicine. And one of the first trainings that I wanted to do is an overview and background training on what Mini-CEX really is. It's been a clinical assessment tool for 20, 25 years. It's been listed as a significant example as an assessment tool in medical and health professions education in textbooks and other resources. And so I just wanted to go through some examples of what it is and what it is not. So first of all, what does MiniCEX stand for? It stands for Mini Clinical Evaluation Exercise, designed to, designed to be 3 to 5 minutes in length, give a good snapshot of the student intern's performance, and also be an example of the student's performance with actual patient and patient encounters. And so this is a higher level of assessment with a clinical observation versus an OSCE, which is an objective structured clinical examination, very controlled, very structured with standardized patients only. And so the difference in this is that with an OSCE, students will read a certain requirements for history, examination, treatment, and then will actually perform that task. In a mini CEX evaluation, this is a real patient encounter. The clinician is going to be the observer and the evaluator. The student may be doing an examination of the heart, the lung, orthopedic examination, maybe doing a history, other kinds of consultation, maybe doing a therapeutic skill, manipulation. Not only do we need to evaluate the actual task, but we may also be evaluating the communication, the ethics, professionalism, the organization of that task also. So the mini CEX is designed to be not only quantitative, giving a score based on the rubric, but also is going to be qualitative, showing that we have progression in uh, the student intern skills also. So like I said, the mini CEX assessment is designed to be a very progressive nature of the student intern's clinical competency. It's a formative assessment of core clinical skills. It's not a summative assessment where we have maybe a midterm and a final, but a formative assessment of numerous assessments during the trimester to make sure that one, we do have that progression, but two, that we identify any kind of weaknesses, but also strengths of the intern also. And we can identify those early and work on those weaknesses and then build upon the strengths also. It's not a checklist. It's not that a student has actually done or not done a certain task, but we are helping to increase the quality of patient care and quality of these competencies and clinical skills. The evaluation of the student should be seamless, so it's not something that we evaluate in week 2 and then we wait until week 8 and we see maybe what the difference is where there's a big space in between, but we should have a continual seamless evaluation so we don't have a lot of pause in between evaluating those skills. And then also with mini-CEX, a large part of it is giving feedback. We don't have to give feedback each and every assessment, but regular and frequent feedback is appropriate with mini-CEX, and especially giving references with that feedback is going to be very appropriate also. And obviously, we know that the clinical practice phase of education is not for giving more lecturing and more one-on-one instruction, but really is a student responsibility with the instructor and clinician feedback to actually uh, improve those clinical skills. So these are two things that we want to really uh, avoid here. We want to avoid kind of a late bloomer student that doesn't really have the clinical competency and clinical skills and doesn't really get assessed and doesn't have that improvement of competency early on in try 8 and maybe the first half of try 9. And then we hurry up with the clinical competency of try 10. And so we want to avoid kind of a late bloomer kind uh, of assessment or an improvement of clinical competency. On the flip side, we also want to avoid a kind of an early gung ho student where we do assessments and we have that improvement of clinical competency, and they may be finished with all of their assessments or quote unquote numbers, and now they're kind of dropping off, and we kind of have that kind of seam between the second half of try 9 and then to try 10, and then right before they graduate, we want to have some improvement. In both of these examples, they do not have the high quality of clinical competency that we expect from our graduates. So what we're really aiming for here with Mini-CEX, this is really the nature of the Mini-CEX clinical assessment tool, is we have a continual, frequent assessment and building upon those skills of the clinic intern. We have numerous assessments in Try 1, we have increased assessments in Try 9, and then we're really focusing on improving the clinical competency skills in Try 10. And because we have requirements in each of these trimesters, it builds upon each other. We don't have any kind of pauses or breaks in between the assessments and the building of the skills. And also we're giving responsibility to the intern to actually improve the skills. So that should give you a little bit of foundation and background in Mini-CEX. Other trainings that you will see is the flow of assessment that we should have with Mini-CEX clinical assessment tool. The nature of the Mini-CEX rubrics, things to remember when we're actually scoring with rubrics and things that will help to make it a little bit easier. I do want to go through the explanation of each of the rubrics and each of the categories to make sure that we know what the requirements of the rubric and the requirements of the clinical skills are. And then finally, we will go through entering the Mini-CEX scores um, into Office 365 and making sure that we're doing that correctly and efficiently during our assessment. And so I hope that this was beneficial. If you have any questions, please reach out. I can always make more trainings or clarify anything regarding the Mini-CEX assessment. This is my email, my office phone number. Feel free to contact me at any time.